I recently injured my knee and my doctor recommended a 3-phase rehab program, and this is phase 2. Leg strengthening exercises begins phase 2. 10 repetitions of each exercise in order with minimum rest in between. That is 1 set. Repeat this cycle for a total of 3 sets. Side lying hip abduction. Lie on your uninjured side with your bottom knee bent, your top leg straight, and your top hip rolled forward to provide stability and balance. In a slow and controlled manner, lift your top leg in the air, leading with your heel. Hold for 5 seconds and then slowly lower your leg to its starting position. You can use an elastic band to increase the difficulty if your leg's weight alone is not challenging enough. Side step-ups. Stand sideways next to a low step, about 3 to 6 inches high. Your entire foot should be firmly planted close to the edge of the step. Step up on top of the step using your injured leg, straightening your injured knee. Pause briefly before slowly returning to the starting position. Use a taller step only if you feel no pain and you can keep your balance throughout the entire exercise set. Walk-in lunges with hold. Stand with your feet hip width apart, legs straight. Take 1 exaggerated step forward and lower your body by bending the back knee until it is 1 to 2 inches above the floor. Hold for 5 seconds, keeping your torso upright. Push the heel of your front leg to step forward, walking into the next repetition, alternating legs throughout the set. A rep is 2 steps. Add time to each hold up to 10 seconds to make the exercise more challenging. Squats with hold. Stand with your feet about shoulder width apart, toes slightly turned out. Extend your arms straight out in front of your body. Sit with your hips back, lowering your body by bending your knees and hips, keeping your heels down, back flat, and arms extended. Lower until your thigh is no further than parallel with the ground. Hold for 5 seconds. If lowering to this depth increases your knee pain, then decrease the depth of the squat. Add time to each hold up to 20 seconds to make the exercise more challenging. Phase 2, core exercises. Perform each exercise with minimal rest in between. That is 1 set. Repeat each exercise for a total of 3 sets. Glute bridge march. Lie face up on the ground, knees bent about 60 degrees with your feet hip width apart and firmly planted on the floor. Lift your hips off the floor, pushing through your heels and squeezing your glutes as you lift your hips. Lift 1 foot slightly off the ground and hold for 3 seconds. Alternate sides in a marching fashion, but continue to keep your hips in the same position. Do not overextend your back. You should feel the activity mostly in your legs. If you feel strain in your back, lower your hips a bit until you feel your legs and glutes take control, and hold there. 1 rep is both legs. Add time to each hold up to 10 seconds to make the exercise more challenging. Plank. Lie face down propped up with your forearms on the ground and your elbows under your shoulders, with legs extended straight. Lift your hips off the ground, creating a bridge from your forearms to your toes. Keep your abdominals tight and your back flat as you hold the position for 30 seconds. Add time to each hold up to 60 seconds to make the exercise more challenging. Side plank from the knees. Lie on your side, propped up on your forearm with 1 elbow directly under your shoulder and your hip on the ground. Bend both knees with your feet behind you. Lift your hips off the ground, creating a bridge from your forearm to your knee. Keep your abdominals tight and your back straight as you hold the position for 30 seconds. Add time to each hold up to 60 seconds to make the exercise more challenging. Phase 2, cardio. The key is low impact activity that doesn't cause pain in your knee. When you proceed to impact running, do so for a maximum of 3 days per week, with a day of rest between running days. As a general rule, don't increase the volume or intensity of your cardio exercises more than 10% per week. If you have an increase in knee pain, scale back the frequency of running to 1 to 2 days a week at a lower intensity. You may use the rower, bike, elliptical, or pull for the remainder of your training days. If pain continues to occur, please see your healthcare provider. Stretches, Phase 2. Perform each stretch for 30 to 60 seconds, and remember to rest in between each stretch. Self-massage quad. Lie face down on the floor with a tennis ball, foam roller, or similar object under the thigh of your injured leg. Support your body weight with your forearms and toes, moving up, down, and around the thigh on the massage object. Try to relax your body, especially the thigh you're rolling. Give extra attention and time to areas in the muscles that feel the most sore. Standing quad stretch with towel. Stand on your uninjured leg with your injured knee bent and a towel looped around that foot behind you. Hold the ends of the towel in one hand while keeping your balance. Hold on to something if you need, and press your hips forward by squeezing your glutes. Slowly pulling the towel behind you until you feel a stretch in the front of your thigh. Lying glute stretch. Lying face up on the ground with both knees bent, cross your injured leg over the other, resting the ankle on the opposite knee. Keeping your back flat on the ground, grab the thigh of the uninjured leg with your arms and pull it towards your chest. You should feel a stretch in the glute of the bent leg. Lying hamstring stretch with towel. Lying face up on the ground, bend your injured knee and loop the towel around the foot of your injured leg. The other leg should be extended straight and resting on the floor. Keeping a slight bend in the knee, slowly lift your injured leg into the air using the towel for support. You should feel a stretch in the back of the thigh of your raised leg. Now that I'm done with phase 2, I feel that I'm ready for the final phase, phase 3.